Did you know that by the time you finish watching this video, approximately 20 seniors will receive a devastating dementia diagnosis? That is one person every 66 seconds. But here is what should really terrify you. What if the root cause is not getting older? What if it is sitting right there in your medicine cabinet? You have been reassured these pills are safe routine, even necessary for your health. But groundbreaking new research is raising serious red flags. 99% of seniors have absolutely no idea that at least one medication they take every day could shrink memory centers in their brain by more than 28% in less than 12 months. Let that sink in for a moment. I know this sounds scary. I am Dr. Michael Kent, and I have seen it happen too many times in my practice. To comply with YouTube medical safety policies, please understand, this video is for educational purposes only and does not replace professional medical advice. Always consult your doctor before changing any medications. People trust their medications completely. They assume if a doctor prescribed it, it must be harmless. Meanwhile, the pharmaceutical industry has known about these devastating effects for decades, yet they continue profiting billions from selling drugs that may accelerate cognitive decline in millions of seniors. In fact, a 2023 study published in Neurology and Aging Research discovered that one particular class of medications increased dementia risk by 49% in seniors within just 2 years of regular use. That is nearly half again the normal risk. In this video, I will reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly overlooked to absolutely mind-destroying. Number 3 on this list is prescribed to millions for something completely harmless, but it can shrink key memory centers without you realizing it. Before we dive deep, I want to hear from you. Let me know in the comments below what medications you take every single day and if you have experienced sudden brain fog after starting a new prescription. We are replying with personalized insights. Do not stay silent, because speaking up could save your mind. Now, without any further delay, let us start at number 9. And do not let its position on this list fool you for a second. This medication is sitting in almost every senior's medicine cabinet right now, and it might be scrambling your brain before you even feel the first symptom. Number 9 is Diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that familiar pink pill that millions of people trust to help them fall asleep, relieve seasonal allergies, or ease cold symptoms. It is inexpensive, available over the counter at any drugstore, and you probably have a bottle of it in your nightstand or bathroom cabinet right this very moment. You may think you are simply taking it to sleep better at night or get a little relief from allergies. From an educational perspective, we need to understand what happens beyond the immediate relief. Inside your brain, Benadryl is actively disrupting your hippocampus. The hippocampus is the specific region responsible for forming and storing new memories. Benadryl belongs to a family of drugs called anticholinergics, which work by blocking a crucial neurotransmitter called acetylcholine. Think of acetylcholine as the chemical messenger that helps your brain create new memories and maintain alertness throughout the day. As your brain ages, it becomes increasingly dependent on every single bit of acetylcholine it can produce. When medications like Benadryl interfere with that delicate chemical process, the results can be absolutely devastating. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular basis had a 54% higher risk of developing dementia compared to those who avoided these medications entirely. That is more than half, again, the normal risk, just from taking what most consider a harmless sleep aid. Society has conditioned us to believe over-the-counter means perfectly safe. But that is a dangerous assumption for your aging brain. To protect your precious memory, avoid anything containing diphenhydramine, especially if the label says PM nighttime or allergy relief. These products are very often just Benadryl hidden under a different brand name. If you use it for allergies, much newer non-sedating options exist like loratadine, commonly sold as Claritin. These do not cross the blood-brain barrier and are dramatically safer for long-term use. Never stop any medication abruptly without medical guidance, but always question what you take blindly. Up next is a medication often marketed as harmless and gentle on your digestive system, yet it systematically interferes with the very nutrients your brain desperately needs to stay sharp. Number 8 is proton pump inhibitors, specifically Prilosec and Nexium. Belonging to a drug class called PPIs, these are designed to reduce stomach acid production and are frequently prescribed for heartburn and acid reflux problems. Many seniors remain on these medications for years, sometimes decades, because uncomfortable symptoms return immediately when they try to stop taking them. But what is rarely discussed is how PPIs systematically interfere with the absorption of vitamin B12. This vitamin is an absolutely crucial nutrient that protects brain tissue and supports memory function, focus, and mood stability. In a groundbreaking 2016 study published in JAMA Neurology, researchers carefully examined over 73,000 people aged 75 and older. They discovered regular PPI users had a 44% increased risk of developing dementia compared to people who did not use these medications. By suppressing stomach acid aggressively, PPIs interfere with your body's natural ability to absorb not just B12, but also magnesium and calcium. These minerals are essential for neural transmission and proper brain cell signaling. Without adequate levels, your neurons struggle to fire efficiently, causing misfiring, confusion, and memory lapses that look exactly like the early warning signs of Alzheimer's disease. Educationally, it is critical to realize our physical systems are deeply interconnected. Altering your stomach environment fundamentally impacts your long-term brain health. The problem goes even deeper because PPIs have also been scientifically shown to increase levels of amyloid beta plaques in the brain. These toxic proteins actively disrupt normal brain function and are considered one of the core drivers of Alzheimer's disease progression. The excellent news is that there are much safer alternatives available. If you use a PPI every single day, ask your doctor about slowly tapering off with the help of H2 blockers like famotidine sold under the brand name Pepcid. While not perfect, these are significantly less likely to interfere with cognitive function. Chewing a bit of deglysyrrhizonated licorice, which is a natural compound, can also coat the stomach without causing cognitive harm whatsoever. Next up is a medication often prescribed for bladder control issues, but it may actually be wreaking absolute havoc on both your short-term memory and your emotional balance. Number 7 is bladder control medications, specifically oxybutynin. Sold under the brand name Ditropin, it is frequently prescribed to seniors struggling with urinary incontinence or overactive bladder problems. On the surface, it seems like a practical, helpful solution since nobody wants to deal with the embarrassment of frequent urgent bathroom trips. But this medication works by blocking acetylcholine, the exact same critical brain chemical that is disrupted by Benadryl. Unlike some milder medications, oxybutynin crosses the blood-brain barrier very easily and directly affects memory regions in your hippocampus. That physiological characteristic makes it particularly dangerous for seniors, especially over extended periods of time. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered people over 65 who took strong anticholinergics like oxybutynin for more than 1 full year had a 49% higher risk of developing dementia. That is nearly 1 in every 2 users. What makes this educational insight so vital is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They are simply told the medication controls their bladder, not that it may be accelerating mental decline with every dose. The cognitive harm is often mistakenly attributed to normal aging. Patients commonly describe feeling mentally foggy, forgetting important appointments, constantly misplacing items, or suddenly struggling to track simple conversations. It is rarely connected back to the medication until significant structural damage has already occurred. If you are taking oxybutynin and notice mental changes, it is not just in your head. You absolutely do not have to stay on this particular drug to maintain bladder control. Fortunately, medical science offers much newer medications, like mirabegron sold as Myrbetriq. This works through a completely different mechanism in your body, showing significantly less impact on memory function. These newer drugs do not block acetylcholine at all and are generally considered much safer options for older adults who need bladder control support. Now, from an educational viewpoint, it is vital to pause and ask you to reflect on everything we just discussed. Are you or a loved one currently taking any of these 3 common medications we just covered? Have you noticed any unexplained brain fog or sudden memory slips that you just brushed off as getting older? Please leave a comment down below right now and tell me your honest experience. We are actively reading every single comment and replying with personalized insights to help you navigate these difficult choices. Let us continue this vital conversation together in the comments section, because being properly informed is your absolute best defense against cognitive decline. Moving further down our list, we encounter a class of medications that are among the most widely prescribed drugs in the entire world, especially for people over 60 years old. Number 6 is statins. These medications are intended to lower cholesterol levels and reduce your risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most commonly prescribed versions. But from an educational standpoint, here is where a serious physiological problem begins. Society constantly tells us that all cholesterol is bad, but cholesterol is not just a heart health issue, it is an absolute brain necessity. Your brain is composed of nearly 60% fat, and cholesterol plays a critical role in creating and maintaining the myelin sheath. That is the protective coating that helps nerve signals travel smoothly and efficiently throughout your entire brain network. When you aggressively lower cholesterol with powerful medications, you may also be starving your brain of exactly what it needs to function properly. In a 2023 study published in Frontiers in Aging Neuroscience, researchers found that seniors over 70 who had been taking statins for more than 3 years straight had a 26% higher risk of mild unpresented cognitive impairment. Those taking high-dose statins had even more noticeable declines in mental function. What is extremely alarming is that some patients reported sudden onset memory loss, describing frightening moments where they could not recall familiar names, recent conversations, or even driving routes they had traveled for years. It is absolutely important to understand that not all statins affect the brain equally. Medications like pravastatin and rosuvastatin do not cross the blood-brain barrier as easily and are considered significantly less risky for your cognitive health. If you have been on a statin for years and you are noticing increasing forgetfulness, it might be time to have a serious educational conversation with your doctor about a dose reduction or exploring an alternative cholesterol management strategy. Do not wait until the damage becomes irreversible. The earlier you take decisive action, the better your chance of protecting your mind. Next on our countdown is a group of medications that provide immediate relief but can eventually become a devastating trap for your cognitive health. Number 5 is benzodiazepines. This category includes commonly prescribed drugs like lorazepam, diazepam, and alprazolam, widely known as Ativan, Valium, and Xanax. These are some of the most widely prescribed medications in the country for anxiety disorders and sleep problems. They work by enhancing GABA, which is your brain's natural calming chemical that reduces overstimulation and nervous system activity. At first, these medications seem like absolute lifesavers. They quiet racing thoughts, ease panic attacks, and help with falling asleep at night. But over time, these drugs transform into something else entirely. From a clinical education perspective, they become a chemical restraint. A 2022 study published in the British Medical Journal followed over 8,000 seniors over a 6-year period. The researchers found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting versions like diazepam, which remain in your body much longer and accumulate in fatty tissues, including your brain tissue. What happens is a kind of chemical sedation that progressively slows down neural activity throughout your brain. That means your brain stops learning new information as quickly as it should. It becomes less flexible, less efficient, and increasingly prone to confusion, memory gaps, and emotional numbness. Seniors taking these regularly often describe feeling like they are moving through a constant fog or feeling disconnected from reality. And the absolute worst part is the physiological dependence. When patients try to stop taking the medication, withdrawal symptoms like severe anxiety, agitation, and debilitating insomnia can be absolutely brutal. This makes the drug feel essential when it is actually the primary source of the problem. If you have been taking these for more than a few weeks, you must remember a crucial medical safety rule. Do not stop suddenly under any circumstances, because this can be genuinely life-threatening. Instead, you must work closely with a knowledgeable doctor to very gradually taper the dose down over weeks or even months. Educational awareness reveals that safer alternatives like busbarone or cognitive behavioral therapy specifically designed for insomnia can restore your peace without destroying your memory. Continuing our countdown, we reach a medication that is often prescribed for several different issues at once, hiding its true danger behind its versatility. Number 4 is amitriptyline, commonly sold as Elavil. This is an older generation antidepressant that is still surprisingly commonly prescribed today for chronic pain conditions, insomnia, and sometimes even migraine prevention. At first glance, it may seem like a versatile multi-use miracle pill that solves several annoying age-related problems at once. But underneath the surface, it is actually one of the most potent anticholinergic medications still in widespread circulation today. That means it powerfully blocks the action of acetylcholine, the exact same vital chemical messenger we discussed earlier that helps neurons communicate, form new memories, and maintain mental sharpness. It blocks acetylcholine so strongly that cognitive effects are not just possible side effects, they are essentially expected consequences with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That is not just a slight increase, it is more than half again the normal risk of dementia. What is absolutely terrifying from a patient education perspective is that the vast majority of these patients were never told that this drug could actively harm their memory function. They were prescribed amitriptyline for sleep problems or nerve pain, and then slowly started noticing troubling changes like short-term memory loss, word-finding difficulties, and increasingly foggy concentration. It does not even require a high dose to cause serious problems. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of brain power that happens completely silently. The damage occurs without warning, mimicking normal aging, but it is actually drug-induced cognitive impairment that could have been prevented. If you are currently taking amitriptyline, speak with your physician immediately about safer alternatives. For nerve pain, options like duloxetine or gabapentin may offer relief without the severe brain burden. For sleep problems, melatonin or very low-dose doxepin carry far less risk. And for mood support, much newer antidepressants like sertraline or escitalopram are generally considered dramatically safer for long-term brain health. Entering the top 3 most dangerous medications, we find a drug that perfectly illustrates why patient education is vital. Number 3 is paroxetine, commonly sold as Paxil. This is one of the most frequently prescribed selective serotonin reuptake inhibitors, or SSRIs, used for depression and anxiety disorders. At first glance, it appears to be a modern, sophisticated medication that is supposed to be far gentler and safer than older psychiatric drugs. But here is the critical educational fact they rarely share with patients. Paroxetine is the only SSRI medication that possesses significant anticholinergic properties. This means it actively interferes with acetylcholine in your brain. That one crucial detail makes it drastically and fundamentally different from its sibling medications like sertraline or escitalopram. In a large comprehensive 2021 review published in Frontiers in Psychiatry, researchers carefully examined the cognitive profiles of elderly patients taking different SSRI medications. They found that paroxetine users showed measurable and significant declines in short-term memory, verbal recall ability, and overall attention span within just the first 12 months of treatment. Furthermore, the study discovered that seniors taking paroxetine were 30% more likely to show early warning signs of cognitive impairment compared to those taking other common antidepressants. Paroxetine is often prescribed specifically to stabilize mood and reduce anxiety, yet it ends up systematically undermining mental clarity and emotional regulation over time, completely defeating its own purpose. The educational takeaway here is straightforward, but absolutely essential for your long-term brain health. Medical authorities strongly advise avoiding paroxetine entirely in older populations. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, which is a carefully compiled index of medications that are potentially inappropriate for older adults due to severe safety concerns. If you are currently taking it, you must ask your physician about safely switching to much safer alternatives like sertraline or acetylcholine, which are significantly better tolerated and do not carry the same serious cognitive risks. In addition, educating yourself on natural support like supplementing with B vitamins, especially vitamin B12 and B6, can help support your mood naturally and may reduce your overall need for heavy antidepressant medications. Number 2 is antipsychotic medications, a category that is deeply disturbing because many seniors do not even realize they are taking them. Drugs like quetiapine or Seroquel, risperidone, and olanzapine were originally developed and approved strictly to treat severe psychiatric conditions like schizophrenia and bipolar disorder. But today, they are frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or everyday behavioral changes associated with dementia. These are incredibly powerful drugs designed for severe illness, but they are now being routinely used in nursing homes and hospitals for seniors who are simply confused, restless, or difficult for the staff to manage. The consequences of this prescribing practice are absolutely devastating to the aging brain. In 2022, a comprehensive study published in The Lancet, Healthy Longevity followed more than 25,000 older adults. They found that seniors who were prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia. Even worse, these dangerous drugs dramatically increase the risk of stroke, sudden cardiac death, and severe sedation, which can directly lead to dangerous falls, emergency hospitalization, or permanent institutionalization. From an educational viewpoint, understanding the mechanism behind this damage is absolutely crucial. These medications aggressively suppress dopamine, which is a chemical messenger intimately linked to mood and motivation, but also absolutely critical for executive function and memory processing in your brain. When dopamine levels crash dramatically, your brain becomes extremely sluggish, slow, and unresponsive to stimulation. This is exactly why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Correcting this tragic situation starts with asking hard, direct questions. If you or a loved one is currently taking one of these powerful medications, you must ask the prescribing doctor why it was prescribed in the first place and whether it is truly medically necessary or just being used for convenience. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug interventions. This includes creating structured daily routines, reducing environmental noise, addressing underlying physical pain, and dramatically improving sleep hygiene. When medications are absolutely necessary, using the lowest possible doses for the shortest possible periods can significantly reduce the harm. More often than not, these drugs are used out of pure convenience for staff, not genuine medical necessity. True health education means understanding that convenience should never come at the cost of cognitive survival. Finally, we have reached the ultimate hidden danger that almost nobody talks about. It is genuinely one of the biggest contributors to drug-induced dementia in the entire elderly population today. You may have been expecting a single specific drug to top this list, but the most dangerous medication situation for rapid dementia in seniors is not one particular pill. Number 1 is anticholinergic polypharmacy. This is the silent, creeping, cumulative effect of taking multiple medications with anticholinergic properties at the exact same time. Imagine this completely common educational scenario. A senior takes diphenhydramine every single night for sleep, uses oxybutynin daily for bladder control issues, and takes amitriptyline for chronic pain management. Each medication alone might cause only mild, barely noticeable memory problems. But when you take them all together, they compound exponentially, and the cumulative anticholinergic burden on your fragile brain absolutely skyrockets. This is not just a theoretical concern or an academic worry. In a massive 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults. They found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That is more than double the normal risk. And here is the absolute worst part of this entire situation. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications because nobody had ever properly explained this fundamental concept to them. When you block acetylcholine from multiple different angles simultaneously, your brain does not just slow down temporarily, it begins to actively decay and deteriorate. Neurons physically wither from chronic underuse synapses, shrink and disappear, and your brain enters a hypoactive state that looks nearly identical to Alzheimer's disease on clinical cognitive testing. But here is the most empowering educational message of this entire video. Correcting this incredibly dangerous situation does not require a miracle cure or an expensive experimental treatment. It simply requires a thorough, comprehensive medication review. You must ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even supplements for their anticholinergic load. There are professional software programs available that can calculate your cumulative anticholinergic burden score. Once the specific problem medications are clearly identified, you can work systematically with your medical team to slowly and safely deprescribe unnecessary medications. You can switch to safer alternatives whenever possible and effectively rebalance your brain chemistry naturally. Drug-induced dementia is very often completely reversible when caught early enough. When this heavy chemical burden is lifted, many seniors dramatically regain their mental clarity, physical energy, and precious memory function within just weeks or months. Your brain is remarkably resilient and capable of healing, but only if you give it a real chance by removing what is harming it. Polypharmacy is not just dangerous, it is completely preventable, and that makes education your single greatest weapon against cognitive decline. To summarize everything we discussed today, no medication is truly without cognitive risk. The greatest educational lesson here is that you must become your own active health advocate. Do not blindly assume your memory loss is just a normal part of getting older. As we have seen, drug-induced dementia is often completely reversible when caught early enough. Your brain is remarkably resilient and fully capable of healing itself, but only if you give it a real chance by safely removing the chemical burdens harming it. I strongly urge you to take your complete list of daily medications to your doctor this week for a thorough, comprehensive review. Now, I want to hear directly from you. Which of these 9 medications are you currently taking, and have you noticed any troubling brain fog? Please share your honest experiences in the comments section below to help warn our community. If you found this educational video valuable, please like this video, subscribe to our channel for more vital health insights, and share it. Thank you for watching. I am Dr. Eric Lawson, and I am here to help you stay sharp and healthy for all the years ahead.